An innovative continuum of care system was set up by Friends International alongside its sister organisation Mitsam Lang in the late 90s to respond to the sudden and rapid growth of substance abuse in Cambodia. Solvent abuse was rapidly followed by methamphetamine use and heroin injection, mostly among young people. HIV infection increased to reach almost 28% of injecting drug users. As a response, Friends International and Mitsam Lang established what is recognized to be one of the most comprehensive drug programs for young people in the world. This continuum of care aims at reducing vulnerability and harm to most at-risk young people, starting with prevention. Marginalized and at-risk children, young people and their caretakers are provided information about the risks of drug use and encouraged and supported to make safe, healthy life choices. For children and youth already using, harm reduction services are provided, including condoms, medical care, safe injecting, and HIV prevention education. This also includes a needle and syringe program, in which used needles and syringes are collected and clean ones are distributed in order to eliminate needle sharing and the risk of HIV infection. Clients are also encouraged to access supervised HIV testing and counselling. When relevant, Friends refers clients to the methadone maintenance therapy services provided by the Ministry of Health and supports them to stabilise their life. Some clients decide to stop their drug use and access a 2-week symptomatic withdrawal treatment in a medically supervised detoxification centre. Detoxification is followed by a 6-week formal rehabilitation programme to develop coping skills without drugs. Former users are then supported for their social rehabilitation through education, training, access to school or employment, and family reunification, as well as ongoing psychological and social support to prevent relapse. Finally, clients receive ongoing support through case management and follow-up to prevent lapse or relapse and access to required routine treatments. The continuum of care is designed so that people can access and re-access services based on their needs at any time. The story of Srey illustrates how this continuum of care is implemented. Srey is 22 and lives on the streets of Phnom Penh. She has been injecting heroin for 3 years. Mitsam Lang outreach workers meet with her, and after some discussions begin to provide services to enable her to reduce the harm she faces. These include information about protecting herself from risks such as HIV infection, and providing materials such as clean needles and syringes, because sharing or using used syringes carries a great danger of blood-to-blood infections. Srey goes to Friendship House, a drop-in centre in the city, where her social worker talks with her about the risks associated with drug use behaviours. She proposes to Srey that she should be tested for HIV by a Mitsam Lang medical staff member. She receives pre- and post-test counselling to support her through this stressful process. Fortunately, her test shows she does not have HIV, but almost 28% of injecting drug users are HIV or AIDS positive. Srey learns from her social worker how to protect herself and others by returning her used injecting equipment, and to keep the area where she lives clear of drug-using equipment. Safer for her, safer for those around her in the community. The Mitsam Lang team meets Srey's family. They provide drug prevention education to her brother and sister to reduce their vulnerability to drug usage. They also provide information to her parents regarding understanding of drug use and addiction, so that they can better understand the issues affecting their daughter and support her in staying safe. They also talk with them about generating income more effectively, which would enable her brother and sister to go to school, further reducing their vulnerability to drug use. They also meet other parents of people using drugs and share their concerns and ideas. Srey decides to become a peer-to-peer worker, providing harm-reducing information and materials to other people using drugs. She works with Sam Nang, another heroin user, and teaches him how to protect himself and others as she has learned from her social worker. After a long support and intensive counselling sessions with his case manager, Sam Nang decides to access methadone maintenance treatment provided by the Ministry of Health. Friends International staff also enable him to access accommodation and vocational skills training in order to stabilise his life and build a better future. Srey begins to consider the opportunities available to her in the future, like stopping using drugs, moving away from the streets and accessing vocational skills training. After a period of reducing, she accesses Mit Samlang's drug treatment centre greenhouse. Srey works with her social worker to develop a range of skills to enable her to cope without returning to drugs. She receives medically supervised symptomatic treatment to assist her through her withdrawal and participates in group discussions. She then decides to access a vocational skills training course and chooses to train in restaurant hospitality. 1 year later, and Srey has attended cooking classes. During this training, she received relapse prevention counselling from her social worker when needed. She has accessed a peer-led support group to help people who use drugs and show them that there are options available to move away from drug use when they're ready, just as she has. She is now a student in a training restaurant, gaining valuable skills and experience that will help her to find a job in the future. A lot was achieved so far. Systems were built, new service providers started work in new areas, collaboration networks were created, and the number of users reached and the number of services provided to them increased as well. However, much still needs to be done, including continuously improving the quality of services, expanding the coverage for services, and accessing populations not yet reached. It is only by working together, civil society, the government, NGOs, international organisations, and with the users themselves, that we will achieve our common goal we set for Cambodia in 2020: 0 new infections.